there will be 5 items for spotting. Spotting mane ki? Some items will be laid on the table, around 5, and you will be having 5 minutes for identifying what the specimen is, and you have to write it in a line, one liner. If it is if a bone has been given, you write it is a human, whatever, human sternum, dried and devoid of soft tissue, one liner for spotting. Okay, spotting a normally 2 marks kore dewa thake ek ekta specimen. 2 marks are allotted for per specimen. 5 specimen, 10 marks. Okay, so one liner should be the answer pattern. In a one sentence, not one word. You will not write one word. You will complete the sentence. It is a human hair, fallen hair, or it is a firearm, whatever it is, rifle, smoothbore. Like in one sentence, that is for spotting. Spotting is for 10 marks. So it will be there in your internal assessment as well as in your prof pattern. Next is the practical part. Practical part consists of viva plus means grand viva as well as whatever the stations you will be attending. For that, before exams, we will have a mock drill, how to attend the specimens. So normally in practical there will be around 5 specimen, 5 to 6, maybe 5, maybe 6, depends. So 5 specimens, each will be having 10 marks. So like one table will be having bone, another table will be having weapon, like any weapon, hammer or your knife or chopper, anything could be there, and you have to write about it. So such table will be having like 1, 2, 3, 4, 5. So we will be mentioning these as stations. So everybody will be moving, like somebody has completed this, he will move to the next station. Like if this is bone, that will be weapon. So the bone, those who have completed bone will move to the weapon, and the weapon person will come to the bone. So like there will be 5 stations. So everybody has to attend 5 stations and write about it. And you will be having only 6 minutes. 6 minutes for each station. এই স্টেশনে বসলাম 6 মিনিট সময় আছে, তার মধ্যেই সব লিখে নিতে হবে, তারপরে নেক্সট স্টেশন, তাহলেই সবাই ঘুরবে। এরকম না যে একজন বসে থাকলো যে আমার এখন কমপ্লিট হয়নি, আমি এখানেই বসে থাকবো, তাহলে হবে না, ওই জায়গায় আরেকজন আসবে। ওকে, সো এক্সট্রা টাইম উইল নট বি দেয়ার। 6 minutes for each station in practicals. So what I am teaching you is from the practical point of view. So we have completed many bones, not all of them, but majority of the bones has been completed. Okay, so today we will be learning about sternum. Sternum, right? তাই তো, sternum মনে হচ্ছে তো, it's looking like sternum, right? You can pass it on among your friends. So this is broken one. This is part of this same specimen. No more. So this will also be a part of your practical exam. So it may be consisting of 10 marks if sternum has been given. So as usual, you have to write, if the sternum comes, what you will write? Starting e ki likhbe? First sentence, any bone.
This is a human sternum which is dried and devoid of
Soft tissue. Okay. Then you will estimate the other things. Okay. What other things? What can you find from it? Ki ki pawa jete pare? We can find the sex, the age, whether any injuries are there or not, stains are there or not, deformity is there or not. These things we can find. Race is not possible, means cannot be determined. Okay. So medico-legal inference, these things you will find. Coming to the anatomy. So anatomy of sternum, it comprises of 6 parts. Okay, remember 6 parts. What are those 6 parts? First is manubrium sterni. Okay, manubrium, right? Then comes 4 sternabrae. Okay, 4 manubrium. Then comes body. Body is consist of sternabrae, that is sternabrae 1, 2, 3, 4. 4 sternabrae, and later on there is xiphoid, right? Chiefly 3, manubrium, body and xiphoid. But the body is comprises of 4 sternabrae, right? Normal anatomy. It's gone. So, can you identify from the specimen I have given to you which one is which one? Konta ki? Body konta, manubrium konta, xiphoid process konta? See here. This is manubrium sterni, right? Manubrium. Then comes, yeah, this is body, and this part is xiphoid. Clear? Chiefly 3, but this body can be divided into 4 sternabrae. 1, 2, 3, 4. So as you can see here, the 4 sternabrae here are fused, right? Shabbai fuse kore geche. So you cannot see any gap here, any line or gap here, because everything has been fused here to a single bone. Even the xiphoid has been fused, right? Xiphoid process with the 4 sternabrae has been fused, right? Everything is fused, and this part has broken off. So this might not have been fused, but or maybe or may not, we don't know for sure. Okay, so we are clear with the, and this is the jugular notch. Okay, and here the costae means ribs will articulate here along those facets. So how do you identify the sex? By that sternum. So there should be some criteria. The easiest criteria is the morphology. Morphologically, you can say the male sacrum is heavier than the female sacrum. Muscular attachments are more prominent in male sacrum, less in generally in all bones it will be the same. But there are specific things you have to tell. First is the Ashley's rule. Ashley, A-S-H-L-E-Y, Ashley, he stated that the manubrium sterni with the body as a whole, if taken, if it is more than 149 millimeters, then it will be male, and less than 149, it will be female. But this is for the European population. Okay, the study was made on European population. So that is Ashley's 149 rule. Okay, we discussed about this Ashley's rule, 149 mm rule, 149 millimeter. For Europeans, this is applicable. Ashley's rule of 149. So manubrium sterni with the body, if we measure it by a scale, we'll get normally 149 or more for males and less than 149 is for females. But this is mostly applicable in Europeans. Fine. The second rule I told you was Hurtel's rule, H-Y-T-R-L, Hurtel's rule. It suggests that the body of the sternum, body part is longer in males. Okay, body of the manubrium sternum is longer in males, whereas relatively in females manubrium sterni is larger relatively. So body of male sternum is more. So how much means longer? How? If we take the manubrium, suppose this manubrium, and give me the body and this part. The manubrium, if it is twice, so if I keep this manubrium over the body, forget about the xiphoid, okay. If I keep over here, okay, over here, then again we keep another part over here, means where it is ending. Then also see it is exceeding, right? It's more, right? Twice the manubrium size, twice the measurement of the manubrium. So it is a male. In case of female, it will be less than twice the length of the manubrium. Clear? That is Hartel's rule. How will you measure? Just take the manubrium. If it is intact, then you take a scale and measure, and then you see it. Whatever you get the measurement, you from the junction of this first vertebrae, you just measure it. If it is twice, more than twice the length of the manubrium, it is male. If it is less, then it is female. Clear? Very easy, simple. Huh? Hartel's rule, HYRTL. Okay, this was very important. Examiner will be wanting to know this, that you know this or not. Okay, so length of the manubrium is more than twice the length of the body is more than twice the length of the manubrium. Clear? So that you should write, even in exam also. While you are stating that it is male or female, some points you have to write in your support, right? So this is one supporting thing, must to write in exam also. The third one is common ones. As a whole, if we see, the sternum is narrower and longer in males, whereas in females it will be little wider. Okay. These all things we have discussed. Now coming to, okay, now we estimate the age. How to estimate the age from the sternum? So, if you see, where is the other one, other sternum? First, for age estimation, you should know the ossification centers. Ossification centers will be present in the manubrium sterni, and ossification centers will be there in the sternebrae also. Okay, and ossification center will be in the xiphoid process, right? So how many ossification centers? 1, 4 for this, 4, 5 and 6. 6 parts, 6 ossification centers. So appearance and fusion, okay, we have to remember. First, the appearance is, the first ossification center appears in the manubrium at 5 months of intrauterine life, in the belly of the mother. Okay, 5th month of intrauterine life. Clear? So first ossification center, manubrium sterni, 5 months IUL, intrauterine life. Second ossification center, first sternebrae, 5 months. Okay. Xiphoid process, ossification center appears at 3 years. Okay, 3 years. Coming. Now you go upwards. Okay. So xiphoid process is 3 years appearance. Then fourth vertebrae will be 7 months. 10 months IUL. 10 months intrauterine life. First is 5 months, manubrium sterni. IUL. 5 months. IUL. All will be in IUL. Okay. 10 months means it's almost near term of birth. But all of them appearance is IUL, before birth. Before birth. Okay. So 10 months is for fourth sternabrae. 10 months means it is approximate. Okay. Or approximate age. 3 years. That's not IUL. Xiphoid process is not IUL. Well, I'll explain you by this picture, then it will be clear. So, if we go from downwards, 3 years, 10 years, then 7 years, 7 years, then 5 years, 5 years, 5 years. That's the way you remember. I will show you by this picture. Manubrium sterni, first vertebrae, second, third, fourth. This is xiphoid. This appears at 5 months intrauterine life. Then first vertebrae also 5 months intrauterine life. Okay. Then second vertebrae 7 months intrauterine life. Again third one 7 months intrauterine life appearance. Fourth one 10 months. Okay. And the last is the xiphoid, that is 3 years. 3 years is not not intrauterine life, it is after birth. Fine. So 10 months it is either, it could be inside, means in the what do you call, it could be intrauterine or after birth also, but mostly it is found before birth, just before birth. Okay. Clear this one? Appearance of ossification centers. 5, very easy to remember. 5, 5, 7, 7, 10 and 3. Clear? Order? 5, 5, 7, 7, 10, 3. This is the order. Okay. So this is the appearance order. Downwards. Okay. It is going down, coming down. Now, the fusion appears in 2 waves. It goes upwards. Fusion ki hobe? Niche theke opore hobe. Niche theke opore jabe. Okay. In 2 waves. First wave and second wave. So, appearance is clear? No doubt about it. Now we come to fusion. Fusion mane joda lage. ठीक আছে? So first wave e ki hoy? First wave. In first wave, the fusion occurs in among the sternabrae. 4 sternabrae. Among the sternabrae, the fusion will appear. 1, 2, 3, 4. Among the 4 sternabrae, the fusion will occur. So it will be like 15 years, starting from 15 years, 15, 15, 20. Okay. 15. So there is lot of disturbance today. Can't help it. Without that picture, it will be difficult for you to understand. So I have to switch it on. 15, 15, 20, 25. That's the age. Okay. Among the sternabrae. So first wave kothay hoy? First wave of fusion occurs in sternabrae. Second wave occurs from the xiphoid and the fusion of manubrium to the sternabrae. Okay, I'll show you. Okay. First wave among the sternebrae, fourth sternebrae with this third fuses at about 15 years of age. Then 20 years. Then 25 years. 15, 20, 25. Clear? Fourth with third will fuse at 15. Third will fuse with second at 20 and second will fuse at first with 25 years of age. Clear? Fusion, that is first wave. And the second wave will be xiphoid will fuse with the fourth at 40 years of age. And this will fuse at old age. First with manubrium sternae, the broken part, this thing. Fuses at old age, that is about 50 to 60 years of age. Clear? So, everybody understood this? Everybody understood this? Okay. To sum up, I will just tell you once again. So, how do you differentiate between sex? First is the size. So, size is longer in males, narrower and longer. And then the manubrium is twice. You will not say manubrium is means length is short in, you should not state. You should state the female is relatively larger than the males, manubrium. Okay, relatively. Actually, it is not. When you keep it, relative means, understand relative. What is the meaning of relative? In comparison. Okay. So, in comparison, it seems that the manubrium, length of manubrium is more in females. Okay. So, manubrium will appear larger in females. Appear larger. And the second thing is that when we measure the body, it will be more than twice the length of the manubrium in males, and in females it will be lesser. So, you choose your words very carefully in exam. Okay. Most of them confuse it and cannot state which one is twice the length. Okay. So, some students say that body is twice, like that. So, in exam you should be clear which one is manubrium or body. Twice konta ho? Manubrium. Okay, twice. So, if we take measure the body, you will find that the length is more than twice the length of the manubrium in males. Boja gelo maneta ki? If you place it like this, still there is some length remaining. এই দুটো main. And then you can state about Ashley's rule and all. Ashley's means 149.1. That is for Europeans. So, manubrium with the body, if we measure, if it is more than 149 millimeter, then it is males, and less than 149, then it is females. Okay. Other things, that is that explains most of it. Now coming to the age estimation. Age estimation, this is the important one. Age estimation from sternum. So, you will state first the appearance. Appearance kirokom hobe? There are 6 ossification centers. First one, that is manubrium at 5 months intrauterine life. Then the first sternebrae 5 months intrauterine life. Then the second sternebrae is 7 months. Third sternebrae is 7 months. Then 10 months. Then the xiphoid is 3 years. And then the fusion occurs in 2 waves. In the first wave, there is fusion among the sternebrae, first wave. That is 15 years, third and fourth, right? Third and fourth sternebrae fuses at 15 years. Then third and second fuses at 20 years. And third and second, okay. And then first and second is 25 years. So, first wave is complete. Then comes second wave. In second wave, there is fusion between xiphoid and fourth sternabrae that occurs at approximately 40 years of age. Okay, 40 years of age. And the xiphoid, manubrium sternae with the first sternabrae fuses at old age, 50 to 60 years of age. Clear? Age estimation কি করে করতে হয় বুঝে গেলে, sex estimation, and the rest is all the same for the all bones. Stains you can write whether stains are there or not. Disease and deformity, or it could be there could be a bone tumor and all those things. And injury marks, if there is what you call chop wound or any fracture or any bullet hole injury, we can come to know. Okay. So that was all about sternum. So in actually how do we find it? So we can perform an X-ray and then we can check, see here there are gaps, okay, in the sternum. These gaps means it has not fused. So from that we can estimate it by X-ray. Other is by performing an autopsy. We mostly in autopsy, if we do it, then we have to take the sternum and then cut it and see whether the ossification center is there or not. So it will be appearing as a red dot. I'll show you. So if we cut it, it will be like a red dot over here. If we cut it, incise it in children's, okay, then we can find this red dot. Children means not children also, those just after birth, okay. If dead born or something, or if we find a body, sometimes unwanted pregnancy, unwanted deliveries are disposed of in dustbins and all. So police may bring such body to you, to the autopsy surgeon, and then they have to perform autopsy, and there will be a question, what would be the age? What could be the age? So one of the parameters you can estimate the age is from the sternum. Okay, by cutting the sternum we will find that, you see the target like thing, bullseye, like that ossification center will be, you can pink color ossification center we can see. Okay, that what I have told you here. So like that target like sign, if we cut it from midline, we will find in the edge. So if we cut it from the midline, okay, so here there it will be like in the lateral view, we can find those circular thing, okay. So if we find it, that means the age is above, if it's present in the manubrium, okay, then it is more than 5 months. Then we can see it also on the first sternabrae, then it will be 5 months. Then the second, it will be 7 months. Third will be 7 months. Fourth will be 10 months. So if all of these are present till the fourth, then it is above 10 months, right? And if it's present in the xiphoid also, then it's above 3 years. Fusion you can easily make out whether it is fused or not. See here, the fusion has happened. It has completely fused everything. Easier fusion one can easily identify. So if you find lines, then only you will cut it, right? To see whether appearance is there or not. Clear? Age estimation. So this completes our sternum. Easy, very easy bone. Okay. Stature cannot be determined, race cannot be determined, only age and sex can be determined. Now we will learn about femur. This part is clear, everybody? Okay. This is the main slide of this class. So, we will not finish the femur today, we will not be able to finish the femur today. I will just brief you about what we will learn in the next class. First, the most important thing is holding the bone in the anatomical position. While answering before the examiner, first you must know how to hold the bone. Anatomy class you must have learned which bone how to hold. The same way you will be holding the bone in front of examiners. Then you should know which part is anterior, which is posterior, all those things. Then one should know the anatomy. In forensic, we don't need the muscle insertion and all, but we need few important points. So what are the important points? First is the head. Okay, the head, what is the size of it? Okay, then we should know about the trochanters, greater trochanter, lesser trochanter. Okay, then we have condyles. What is this? Lateral epicondyle, medial epicondyle. So the most important is holding the bone and knowing which one is which part, which is anterior and which is posterior. So where there is what is this? Intercondylar ridge, notch or ridge. Okay. So this thing will be mostly in the posterior aspect. Okay. This notch. So it's very easy. Otherwise, if somebody thinks that just knowing this part, I can make out anterior posterior, very difficult. So this is the easiest one. Then where you find this notch or this ridge, that is the posterior aspect. So this is the anterior aspect. So this is of which, left or right? Left. Okay, left. Fine. Head, neck, greater trochanter, lesser trochanter, epicondyles, and this notch. Another one is linea aspera. So you should know about linea aspera, and from the linea aspera there is a measurement called popliteal length. So where the linea aspera ends, from there to the lower surface, we take a measurement, that's called popliteal length. Okay, that we will discuss in next class. So that gives us about the sex of the not sex also, sex of the femur. Okay, whether male or female, popliteal length, other things, other parameters are also there. Overall length of the femur, then greater trochanteric length, all those things, head, size of head, these things will determine the sex. Okay, so best bone for determination of stature, femur. So stature, if the question, if somebody gets this in their exam, the first question they will ask that for best bone for determination of stature. So you should answer femur or long bones. First you should answer long bones and then example femur. Okay. So how you measure it? How you measure it? By putting the bone on the osteometric board. So this is Hepburn's osteometric board. Hepburn, H-E-P, Hep, B-U-R-N, burn. Hepburn's osteometric board. There are others also, but this is Hepburn's. Okay. Hepburn's osteometric board. So as usual, the question, what is this? Same, it is a human femur dried and devoid of soft tissue. All as before. So and again, same questions, same set of questions. How do you know whether it is of male or female? So all those things. Same for every fragment of bone, precipitant and DNA test, same. The pattern of question is same for everyone. So what we can determine? Race, sex, age, injury, stain, stature, disease, same as usual for all bones, but here we can find the stature, and race can also be determined. Race and stature can also be determined among the other factors. Tale, this bone, if it is in exam, it will take time to write, because you have to also estimate the race as well as the stature, right? Sternum, it is very easy, only two parameters you can find out, age and sex, and other things you will write. Race cannot be determined, stature cannot be determined from sternum. Okay, but in this case you have to find all those parameters. Race, if it is asked in exam. So normally exam will state what they need. So previously in this exam, like age, sex, stature and race was mentioned, if it can be. So somebody gets this bone, means they are in big trouble. You have to estimate the stature, you have to estimate the race, you have to estimate the all those parameters, 4 parameters. Fine. And others are same. Any disease, deformity, stain and all those things is same for everyone. That can be. For race, there are 3 parameters. Race, determination of race. So race, there are indexes. Okay, I'll show you. Morphologic features are not very reliable, so it's not of very much use. Means if according to morphology, they say that the Africans, the length is more, Americans or Europeans, the length is relatively lesser, and in Asians it is lesser. Okay, so maximum length in Negroids, then comes Caucasians, then comes Indians, means what you call Asians, or okay. So morphological features doesn't play much role. Bone length also varies, but index are main. You have to remember the 3 indexes: crural index, intermembrane index and humerofemoral index. Okay, so these are nothing but indexes measuring the bones, upper extremity, lower extremity, like what you call humerus with femur, or upper limb by lower limb. Taking those data, means measurement, we calculate it. So by that way we can calculate the race. So what are those? Crural index is length of the tibia by length of the femur, means in the lower extremity only we can divide and find a ratio, and that we will get to know whether it is of which race, European, Caucasian or Negroids. Okay. So these in exam nobody will ask you about the values. Mostly they will ask you about what are the indexes. So you should remember the name of the indexes. So this was crural index. Then there is femorohumeral index. It's not working. Yeah, humerofemoral index, humerus by femur. Humerus by femur into 100. That will also give you a ratio. For males it will be for means Europeans and then Negroids and Indians, the values will be different. Anyway, you can see here the maximum is for the Negroids, and then comes Europeans and then Indians. Okay. So if you take in general, the bones of the Negroid race is larger. Okay. Then comes what do you call Europeans, and then comes Asians. Okay. Now sex as usual, we'll learn that in next class. Sex and age. Okay. Intermembral index is it is upper limb by lower limb. Wait. Upper limb by lower limb. Okay. Upper limb by lower limb.